Hi, I'm Dr. Ginevra. Welcome to day 23 in approximately 30 days of my fibro life. It's actually taking a bit longer than that because it's hard to make a video every day, I'm discovering. Today I want to talk about a subject that's pretty important, I think, as far as affecting a lot of people with fibromyalgia. So I want to talk about how physician bias or physician negative attitudes towards patients can actually cause harm. So on Friday, a few days ago, I was doing a continuing medical education course, and the topic was about kind of racial and other kind of health disparities and how it affected patient outcomes. And what they found, I mean, it kind of makes sense, but what they found really significantly in lots of different studies is that if patients feel that there is some racial bias or other bias against them, patients have much worse both physical and mental health outcomes. And that got me thinking, I wondered if there was any studies that had been done looking at fibromyalgia patients and if they felt, if fibromyalgia patients would have worse health outcomes if they felt some bias towards them or their disease condition. And, logically it makes sense that would be a connection. But, I'm a data geek, so I wanted to see if there was some studies out there. And in fact, there was one. So back in 2013 and 2014, there was a survey done of approximately 670 fibromyalgia patients. And basically, they filled out scores about how validated or invalidated they felt by their healthcare provider. And so the things they looked at were whether they felt their physicians had an attitude of distrust towards them, an attitude of suspicion, an attitude that showed a lack of support for fibromyalgia, and a lack of acknowledgement of fibromyalgia. And so the higher that score was, and they called it like an invalidation score, the higher that score was, the worse patients' outcome were. And so what they found is that the more invalidating experiences that patients had with their providers, the worse their quality of life. And what's very interesting is the opposite was also true. The higher the trust fibromyalgia patients had in their physician, the lower their pain levels were and the better their quality of life was. So, it's just a survey study, so there's certainly, it's not perfect, but I thought it really kind of documented something that logically would make sense to all of us. And I have to say, I found this study really depressing and kind of discouraging. And, there's so far we have to go as far as making sure that every physician out there understands and acknowledges fibromyalgia and knows how to treat it. And so, I kind of fell into a little bit of like a depression. And then kind of today I've started to crawl out of that a bit, and kind of it reminds me of my mission and why I need to be out there trying to educate other physicians and healthcare providers so that they both understand fibromyalgia, they acknowledge it, and they don't treat their patients in a way that is invalidating. So with that, I will say thank you for joining me today. Hopefully I will make a video tomorrow. I'm trying to, finish up these 30 days within something close to 30 days. For those of you that have been with me on this journey over these past few weeks, I really appreciate it. If you're just joining me, thank you. And I plan to make many more videos after this. But in the meantime, until we meet again, stay fierce.